Hello everyone! Welcome back to my YouTube channel. It's me, Tala P. And for today's podcast, it's all about hematology. But before that, please subscribe to my channel for more videos, not only for educational category for the Medical Technology Series podcast, but also let's unwind and check on my travel videos. Please also like my videos, comment for some recommendations and suggestions, and it's a bonus for me if you're going to click on my notification bell for updates. Thank you so much. All right, let's start. For today's podcast, it's all about hematology. And what topic are we going to discuss for this hematology? So, for today's podcast, we are going to deal with poikilocytes that are secondary to membrane abnormalities. But before that, let us define what is all about poikilocytes. So, if you heard of this word, poikilocytes, these are the abnormal shapes of the red blood cells that can be visible if you are going to observe them and visualize them under the microscope. So poikilocytosis meaning that there are variations in the shapes of the red blood cell. And by the way, what is the normal shape of our red blood cells or the erythrocytes? Normally, the erythrocytes measuring 6 to 8 microns in diameter, they are biconcave in shape. Of course, the red blood cells, they are non-nucleated. And these poikilocytes that are secondary to membrane abnormalities, examples of these are the following. So the first one is acanthocytes, and the others we have here BURR cells, echinocytes or crenated red blood cells, the ovalocytes and elliptocytes, spherocytes, stomatocytes or the mouth cells, and lastly are the target cells. So these are the poikilocytes that has an abnormality with the shape of the red blood cells that is associated with some membrane defect or membrane change. So we start with acanthocytes. As you can see, these are acanthocytes. What we can observe here, if you are going to view them under the peripheral, under the microscope using the peripheral blood smear, and by the way, this is an unstained smear. So it's not stained with any hematological stains for the visualization under the microscope, but this one is a fresh unstained red blood cells. So these poikilocytes, they usually show irregularly spaced pointed spicules. As you can see, there are long and short projections in the red cell membrane, and it looks like a thorn. They are thorn-like. Usually the number of the projections are ranging from 3 to 12 of various lengths and widths. So there are short projections, there are long projections, and these acanthocytes, they indicate permanent cell damage, and they may be caused by changes in the ratio plasma of the ratio of plasma lipids. So what are these plasma lipids? These are the cholesterol, the lecithin, and the sphingomyelins of the red blood cells. So that's the defect of this type of poikilocyte. They have changes in the ratio of the plasma lipids, such as the cholesterol, the lecithin, and that of the sphingomyelinase. And if we observe this in the peripheral blood smear, numerous acanthocytes in that blood film, it may indicate conditions such as end-stage liver disease, or it is also associated with an enzyme deficiency known as the PK or that of the pyruvate kinase deficiency. Another is it can also be associated with the condition known as congenital abeta-lipoproteinemia or the Bassen-Kornzweig syndrome. So those are acanthocytes. And the next poikilocyte that is also secondary to membrane abnormality are the BURR cells. So if you observe in the first picture, the acanthocytes, they have short and long projections. And these BURR cells, they are having short projections in their red cell membrane. So with irregularly sized and then evenly spaced spicules, usually they are ranging from 10 to 30 scallop short projections. And like in the acanthocytes, there are long projections, but in the burr cells, usually the number of the projections are many compared to that of the acanthocytes, having 10 to 30 scallop short projections. And these burr cells, if we observe this under the peripheral blood smear, it means that there is a depletion of the energy or the ATP levels of these red blood cells. And this may indicate renal insufficiency or kidney disorders. It may also indicate liver disease and others such as vitamin E deficiency or vitamin E, it's known as the tocopherol. And in general, these burr cells, if we observe this poikilocyte, they may occur in situations that cause a change in the tonicity of the intravascular fluid, such as they may have an increased intracellular calcium, and they can be also associated with alkalosis. And aside from that, these burr cells, they can be associated with drug-induced they are drug-induced associated, such as examples of the drugs wherein this can be associated with the burr cells are mesna 5-fluorouracil, and the other one is benzodiazepines. So those are burr cells. And the next one is the crenated red cells. So these crenated red cells, also known as the echinocytes, they have evenly distributed, uniformly blunt spicules or bumps. So morphologically, they are the same with that of the burr cells, but in terms of the associated conditions, the more serious condition that can be associated to is more in the burr cell, because in crenated red blood cells or the echinocytes, usually you can observe for serrated edges over the entire surface. This one, serrated edges over the entire surface of the cell, and they appear crenated in the blood smear. And we usually observe these echinocytes when they are observed in the peripheral blood smear. They are usually an artifact that results from maybe they may result from excessive EDTA anticoagulant, that of the ethylene diamine tetraacetic acid, or these echinocytes, they may appear as an artifact because of improper smear preparation. That can also be a cause why these red blood cells turn to be a crenated one. And the other one is it can be due to a prolonged sample. So maybe the specimen that is used for blood smear preparation is several hours old anticoagulated blood. So that may be also one of the factor why these red blood cells turn to that type of poikilocyte. Prolonged sample storage before blood film preparation. Okay, so that's echinocytes or crenated red blood cells. The next one, we have here ovalocytes and elliptocytes. Obviously, these are ovalocytes, oval in shape, and those that are in rod or in pencil shape, these are the elliptocytes. So these ovalocytes, elliptocytes, they may range from egg shape to slightly oval to sausage or rod or pencil forms. And also, as you can see here, the two ends of the cell leaving a normal central pallor area, but the hemoglobin appears to be concentrated. But each end of the pole of that ovalocytes and elliptocytes, it appears to be a normal central pallor area. And what is the defect of this type of poikilocyte? They may be associated with a decrease in a skeletal membrane protein band 4.1, or this protein band 4.1 in the red blood cell membrane. We also call it as the Beatis protein, Bea, and then double T and then Y, that is Beatis protein. So that's the defect or the change that is the cause why these red blood cells turn into that ovalocytes and that of the elliptocytes, or there is an increase in heat sensitivity of the spectrin of the red blood cell membrane. And with the conditions that are associated with this type of poikilocytes, usually the presence of large numbers of elliptocytes signals an inherited condition, or it may indicate usually the large numbers of these ovalocytes and elliptocytes from 25 to 90%, they may indicate a inherited condition known as hereditary elliptocytosis. And small numbers of this poikilocyte, they may be associated with 10% maybe of the smaller numbers of these poikilocytes. They may be associated with iron deficiency anemia, megaloblastic anemia, sickle cell anemia, thalassemia, and myelodysplastic anemia. And take note that these ovalocytes and elliptocytes, they can appear normochromic because of the hemoglobin concentration appearing to be in normal central pallor area. They may also appear as hypochromic. When we say hypochromic, it means that the red blood cells, they have less hemoglobin than the normal, and they appear usually pale in color. And counterpart of that hypochromic, but these ovalocytes and elliptocytes, they are not appearing as hyperchromic, but to differentiate it with the terminology hypochromic, hyperchromic is the state of the red blood cell marked by an increased hemoglobin content. So again, these ovalocytes and elliptocytes, they can appear either as normochromic or hypochromic, or normocytic or microcytic. So microcytic, hypochromic cells, just to highlight the examples of anemia that has a microcytic hypochromic red blood cells, you remember the mnemonic PATIS. So it refers to letter P, plumbism, also known as the lead poisoning. That is a microcytic hypochromic type of anemia. Although this plumbism or the lead poisoning, it's not an anemia, but it is a heavy metal poisoning. But this type of heavy metal poisoning can lead to one type of microcytic hypochromic anemia, and that is sideroblastic anemia. Okay, so number one, that of the letter P, it's plumbism or lead poisoning. That of the letter A, it refers to anemia of chronic disorder, or we call it also as anemia of chronic inflammation. That of the letter T is thalassemia. That of the letter I, it's IDA or iron deficiency anemia. And lastly, sideroblastic anemia. So you take note on those examples of microcytic hypochromic types of anemia. Just a segue for hematology, and I'm going to have a separate discussion for that. And next one is spherocytes. So what are these spherocytes? As you can see, the spherocytes, they are smaller in diameter than the normal red blood cells. So the normal red blood cells, they are usually 6 to 8 microns in diameter, and less than that of the 6 microns in diameter, those are spherocytes. And not only that, if you observe them under the peripheral blood smear, they usually have a darker color in terms of its pigmentation, because they have a concentrated hemoglobin content, and usually they do not have visible central pallor. So as you can see here, this one, it has a visible central pallor. Usually it's like a clear area at the center of the cell, but this one, it has no visible central pallor. So these are spherocytes. The unique morphological characteristic of these spherocytes, they do not contain visible central pallor. Unlike in the normal red blood cells, we can observe that. And in spherocytes, they have concentrated red blood cells. That's why they don't show any visible central pallor. And the defect that is associated with spherocytes, they usually indicates a hemolytic process. So usually the hemolysis, it may result from a membrane abnormality. So it is caused by a defect in the red blood cell membrane. And the conditions that are associated with these spherocytes, the two most common are hereditary spherocytosis, of course, and the other one is IHA, that of the autoimmune hemolytic anemia. So you remember the two most common conditions associated with this type of poikilocytes are hereditary spherocytosis and that of the autoimmune hemolytic anemia. Additional to that, ABO incompatibilities also may be associated with this type of condition. And that's it for the spherocytes. And the next type of poikilocyte that is also due to membrane abnormality are the stomatocytes. Stoma, from the word stoma, it means mouth. So these stomatocytes, they are also known as the mouth cells. And the normal size cell that appear to have an elongated or slit-like mouth or stoma instead of the circular central pallor. So normally that of the central pallor of the red blood cells, it is like this. It appears circular in shape, the circular central pallor. But in stomatocytes, what is abnormal? It's not the cell that looks like a mouth, but it is the central pallor giving a slit or mouth shape in appearance. As you can see here, it looks like a slit, making the cell looks like a mouth cell. So those are stomatocytes. And it also looks like a cap shape. If you cannot check that on the choices for theoretical examinations, so they also look like a cap shape. And what does stomatocytosis indicate? So they may indicate hereditary stomatocytosis in which the membrane or the outer coating of the red blood cell leaks sodium and potassium ions. So in hereditary stomatocytosis, there is a membrane defect that results in high cellular sodium and low potassium content. There is an increased permeability to sodium, that of the hereditary stomatocytosis. Additional conditions that are also associated with numerous stomatocytes in the peripheral blood smear, they may also indicate Rh null disease. And aside from that, obstructive liver disease and alcohol excess. Less common causes for this type of poikilocyte, they may be associated with hydroxyurea therapy and myelodysplastic syndromes. And lastly, we have this target cell. So as you can see, it looks like a bullseye cell. These target cells, they are also known as the caudocytes, and they have an appearance of a shooting target like this with a bull's eye. That's why it is termed as the target cells. And if you are going to scan them under the electronic microscope also, these target cells, they may also appear to be a bell-shaped or a tall hat shape. That's why, hence the name, Mexican hat cell. So there are numerous synonymous terms for the target cells. Aside from the caudocytes, they may also be called as a bullseye cell because of this one. And aside from that, if you're going to view them under the electronic microscope, you can observe for a bell-shaped or a tall hat shape. That's why they named it as the Mexican hat cell. And what is the abnormality with these target cells? So morphologically, they have a central area of hemoglobin. As you can see here, there is a central area of hemoglobin, this one, surrounded by a colorless ring and the peripheral ring of hemoglobin. So this one. And this type of poikilocytes, they are associated with hemoglobinopathies. So they may indicate hemoglobinopathies. They are also associated with thalassemia, post-splenectomy, some other conditions such as obstructive liver disease. And like in acanthocytes, these target cells, the defect or the change may lie with an increase in cholesterol and phospholipids. And in target cells, there is also an excess surface area to volume ratio. Okay, so that's it for the examples of poikilocytes that are secondary to membrane abnormalities. And there is also a continuation of this video entitled Poikilocytes that are secondary to trauma. Thank you so much for listening, and I hope that you have learned something from this simple video discussion regarding hematology. And please subscribe to my channel and don't forget to like, comment, and ring the bell for notifications for more upcoming videos, not only for the Medical Technology Series podcast, but also for about anything like travel and many more. Thank you and have a good day.